Good day and welcome to Westchester Talk Radio, westchestertalkradio.com. I'm John Marino. We are produced by Sharc Creative, made possible by Entergy. We thank everyone at Entergy for all they've done for our communities around this area throughout the years. By Robeson Oil, the house that service built. By Lipolis Electric, don't be left in the dark, get Lipolis. And by Hightower Westchester, managing your wealth to a fiduciary standard. We are joined by Dr. Sherlita Amler, Westchester County's Commissioner of Health, the Health Commissioner for Westchester. Dr. Amler, welcome back to Westchester Talk Radio. I want to start off by asking you, how effective have vaccines been in your mind to date? Acceptable enough, even better than anticipated, or do we need to get them up to the speed you would like?
Well, unfortunately, no vaccine is 100%, and that's true of COVID vaccines too. But they have been amazingly effective. Both Moderna and Pfizer have been around 95% effective in preventing COVID, but even more importantly, they've been virtually 100% effective in reducing death. And it's really, I always tell people, okay, so I get influenza or whatever disease I'm being vaccinated against. I don't want that. But the bottom line is, I really don't want to end up in the hospital and I don't want to die from it. And if you can prevent those two things, that's the real goal, is to keep people alive. So I think these vaccines have been exceedingly effective. Now, Johnson & Johnson, the studies were done in a slightly different way, but they were proven to be about 85% effective in preventing hospitalization and death. And so again, that's the bottom line. We just don't want people to die from this virus.
Are there any COVID pockets still remaining in Westchester where some areas are being hit by COVID still a bit higher than others, even though the numbers have gone way down?
Well, our numbers are really down. And in fact, the number of positive cases that we're getting a day has been trending someplace between, less than 100 for sure. Some days even as low as 30 new cases a day over the last couple of weeks. So we have seen a dramatic decline. We saw that last summer as well. Is it the summer? Is it the vaccines? Probably it's a combination of all of these things, because as the weather improves, people are outdoors. They're less inclined to be in large groups inside, spending more time outside where definitely there's less chance of spread of the virus. We worry. We're always concerned. We're looking to see what's going to happen once we get into the fall. But hopefully the coming fall will not be like last fall where we saw a dramatic increase in the number of cases. Mm-hmm. So our goal is to get everyone vaccinated as quickly as we can, because we want to reach that magic herd immunity. And once we get there, we'll all be in a better place. And why that is so important is that you hear about the emergence of variants. And so what is a variant? And a variant is when, as the virus replicates, there's a change that occurs. And that change can make the virus more lethal, or less lethal. So what do these variants do that are of concern to us? Well, as I said, it may affect how the virus spreads. It may make the virus spread more, or it may make the virus spread less. But our concern is always when it makes the virus spread more, when it causes more virus to be produced in our upper airways, and that makes it easier for us to transmit it to other people. If the variant makes the disease more severe than the that we currently have circulated, that would be a concern to us. If it is able to cause reinfection in individuals who previously had COVID, that would be a variant that would be of concern. And if somehow or other it enables the virus to evade the immune systems that our immunizations have provided, that would be a major concern to us. So these are all the issues that we worry about with variants. And obviously, the more people we get vaccinated, the less risk we have of variants and the less risk we have of any of these problems occurring.
What percentage of the county is vaccinated right now?
Well, we have about almost 59% of our population that's received at least one dose, and about half of our population are fully vaccinated. They've had either one dose of Johnson & Johnson or 2 doses of Moderna and Pfizer. We just started vaccinating the younger population. So we just have really begun on that 12 to 18-year-olds. The 17 and 18-year-olds, we've vaccinated somewhere around 13,000 individuals in the county, and the 12 to 16-year-olds, somewhere close to 5,000. They've only been able to get one dose because we haven't been vaccinating them, but just a very short amount of time. So nobody's been vaccinated in that age group long enough to get the second dose. And we can't use Johnson & Johnson on them because it's not approved for children. So the only vaccine that is approved for use in this population is Pfizer. So we have been doing vaccine clinics in some of our schools. The county center, if you have a child that's over 12 years of age, you can walk in there and get your child vaccinated. And so, we would really encourage any parent that has a child between the ages of 12 and 18 that is now eligible for vaccines to please get those children vaccinated.
Are you happy with the number of people who've been vaccinated so far, acceptable for you so far, or do we really need to ramp up the speed of vaccinations now?
Well, we've been very successful. I mean, our rates are higher than the state of New York on average. So I think the county has done a great job. But of course, there's still people out there who have concerns. And, if you have concerns about getting vaccinated, I would suggest that you speak to your doctor, someone that you trust in the medical field who can help give you some advice, or to reach out to the health department. We're happy to have that conversation. But it's really all about, as I said before, not just getting sick. It's all about not dying. And we do know that vaccines are very effective against keeping people out of the hospital and preventing fatalities. So that's the major reason I would suggest it. And I do want to mention that we are having there's going to be a vaccine clinic at the Westchester County Airport on Monday, May 24th through Friday, May 28th from 5 to 9 p.m. So that's at the Westchester Airport. It's going to be with Johnson & Johnson, which is one dose. There's no charge, of course, and you don't need an appointment. And you don't have to be flying anywhere. It will be near the baggage claims. So you can simply go to the airport, park in the parking garage there, walk in, and get a Johnson & Johnson, and you'll have one shot, and you'll be fully vaccinated.
Mm-hmm.
It's, like I said, today through Friday from 5 to 9 p.m.
Mm-hmm. Now, you're working hard, obviously, to make vaccines as available as possible. A free clinic like this at the county airport. You talked about bringing your kids into the county center. The magic number, herd immunity, in your mind, what is it? 70%, 80%, 85%? We hear different numbers from different people.
Well, I think the thing that we need to remember is that it isn't just about the people that are vaccinated. The people who've actually had COVID also may have some immunity. So the numbers we'd like to get to are people with immunity is somewhere around 80%. The problem with the people who had COVID is twofold. We don't know how long that immunity will last, and we don't know if these variants are going to be able to overcome any immunity that having natural disease might have provided. So I think, I would not want people to think, well, I had COVID, I don't need to get vaccinated, because unfortunately we don't know that's true. So I would strongly encourage everyone who is eligible, and that's anyone who is over 12 years of age, to get vaccinated. I think we've been very, very successful in our over 65 population, and that a lot of people in that age group have been vaccinated. Something like 70% of our over 65 have been vaccinated. So, we want to encourage the young people who, right now, that seems to be where the disease is spreading. It's primarily your teenagers, your young people in their 20s and early 30s. a lot of times they feel like they're not going to die if they get COVID. And they may not even get sick if they get COVID. The problem is that they could give this virus to somebody else who could die. And they might not even know it, because 40% of all people who have COVID have no symptoms. So you might have no symptoms. You could be in a grocery store in close proximity to somebody, anywhere you go. And if there's somebody who has any major underlying medical conditions, they're older, you give them this virus, they could die and you might never even know it. So it's really important that everyone who hasn't been vaccinated gets vaccinated to protect everyone around them. But I think more importantly, you want to vaccinate the people who you are around every day. So the people you care about, you want to get vaccinated to protect them, to protect, your loved ones, your friends, your relatives, everyone you care about. So it isn't just about you. It's about everybody you love and protecting everyone around you from you.
Dr. Sherlita Amler is the Commissioner of Health here in Westchester County on Westchester Talk Radio. Doctor, from what you can tell with your studies and research, et cetera, it might be too early to have a real definitive answer on this. Vaccine protection, how long might that last for? Maybe.
We really don't know. So the studies are continuing. So people have been vaccinated. The drug companies continue to monitor people who have a group of people that have been vaccinated to see how long does this vaccine provide the appropriate amount of coverage. And it's too early yet for us to know that. So we'll have to, stay tuned and we will figure that out. But right now, I don't have a scientifically based answer for you. But I think certainly at the moment, it's our best hope of getting back to life as we all want it to be. I mean, right now things are opening up. A lot of places you're no longer required to wear a mask. And unfortunately, still, children in school systems, teachers, kids still have to mask. Healthcare providers still have to mask. Daycares still have to mask. But a lot of places now, you're not required to wear a mask. And I don't think anybody wants to go back to the way the world was, even back in February and March and April of this year. So, we just need everyone to pull together. Let's get this done. Get everyone vaccinated and move forward.
Mm-hmm. Now, why won't some people get vaccinated? I'm going to preface this by mentioning two recent incidents I had with a couple of very close friends. One had COVID at the outset over a year ago. She was laid up for 5 weeks, lost her job as a result, and I believe had a legal case against her employer because she can't do that in the state of New York, not bring somebody back to work after they had COVID. And she said to me, I'll never get vaccinated. I'd rather have COVID again than get a vaccine, to which I said, I pretty much have an answer for anything. I can't answer that at that point. And somebody else said to me a few days ago, John, it'll change your DNA, to which I said, I'd rather have my DNA changed if that's the case and get protected against COVID because I know I can't beat that.
Well, first of all, I cannot change your DNA because
right.
This is a messenger RNA, and the vaccine only encodes for a tiny piece of the messenger RNA that is on the spike protein of the virus. It's not competent. It can't replicate. So there is no way possible for this virus to alter your DNA.
We see the disinformation that's out there with words like this.
Yes. So people shouldn't worry about that because that's just not physically possible to have happen. But still, I understand that a lot of people don't understand the science behind this, and they need people to explain to them why they shouldn't worry. If that's your worry, that's not a problem. The second thing is I do see people who say, well, I had COVID and I wasn't that sick. Why should I worry about it? Well, you don't know that if you have COVID again, you're going to have the same clinical outcome. You might not have been sick the first time. You could have an exaggerated immune response. You could be quite sick the second time. And besides that, we do know that some people who get COVID do have an immune response, a really strong immune response. And they can have serious complications that last for a very long time. They call them long haulers. That's the term that some people are using, where they are so ill that they are unable to return to work many, many months after they had COVID. They may have underlying lung or heart problems that just don't resolve, or just extreme fatigue that don't resolve, that these problems don't resolve even many, many, many months after the COVID infection. And so you don't want people to have to go through that. And I think it's the same kind of thing, when we have vaccines for other diseases. I mean, a couple of years ago, we were trying to get people to vaccinate their families for measles. And I think we have lived in a world for so long where there aren't infectious diseases that are vaccine preventable that we know about or that we see. I mean, you talk to people and say, well, I never knew anyone that had polio, or I've never seen a case of measles, or, none of tetanus or pertussis, or, so they don't seem relevant to people's lives. But the reason that we never see these things is because we have largely eliminated them from our communities. And so it's because of the hard work, the scientists, the doctors, and because of people's willingness to do this in a time when vaccine preventable diseases were rampant in this country, that we have gotten to the wonderful place that we are. And polio is the best example of that I can give you. I mean, we haven't had a case of polio in this country in decades. But in other parts of the world, polio still kills people. So, we should be grateful that we don't have these diseases in our country. And hopefully we will not have COVID in our country. And if that happens, it will be because vaccines have been effective.
Should we simplify this and just require everybody to have a vaccine passport? That may not seem nice, as some people suggest, but it is for everybody's safety. It would be if we did that.
Ultimately, you never know, that may happen. I mean, right now, this is under an emergency use authorization. Probably the FDA will surely be giving it a full approval. And when that happens, we may see that happening. Just
how about President Biden's desire to have every American at least consider a vaccine and get 70% inoculated by early July? Is that 70% figure pie in the sky, or can we get there?
Oh, we could definitely do that. I mean, there's plenty of vaccine out there, and there are tons of places you can get vaccinated at, pharmacies. You can get vaccinated at state-run facilities. You can get vaccinated at the local county. We have been doing vaccines in our clinics as well. And healthcare providers now, more and more, are offering vaccine in their offices or through large practices. So there's a ton of vaccine out there, unlike some countries and, in other parts of the world where people would do anything to get a vaccine. We have the luxury of having vaccines available to us. So it's the only limiting factor is people's willingness to go get the vaccines. And I think people are, waiting to see what happened. Well, so far, it's been a very, very successful endeavor.
Is there a light at the end of this COVID tunnel here? Finally, do we see the finish line, the end zone, or do we still have to be extra vigilant for some time to come?
That's going to depend on if people take this seriously and get vaccinated. If everyone would take this seriously and get vaccinated, I fully believe that we could put this behind us and move on. And, and as long as we don't get any really serious variants, of course, they can also come in from overseas. I mean, we have people traveling into this country from places where COVID is much more active than it is in the United States.
India, Brazil.
Yeah, exactly. So, there is we're not wrapped in plastic. There's no giant bubble around the United States, and the world is a much smaller place than it used to be. So you can leave almost any place in the world and be here in a day. And with you can bring your disease. So that is one of the reasons it's so very, very important that we get as many people in the United States vaccinated as quickly as we possibly can, so that when these individuals come into this country, if they do have a variant, that it has no place to go, and that we don't see widespread of some of these really dangerous variants that are out there in the world.
Mm-hmm. Now, for anyone, you talked about it a few minutes ago, who has any questions about any of this, again, how can they contact the Westchester County Department of Health and get all their questions answered and concerns alleviated? I think that's the most important thing, having people's concerns alleviated.
Well, I think the first thing I would suggest to them is go to our website, because on our website, we have all kinds of information around COVID. We also have our office numbers where you can call for questions. But that would be the first start, because probably more than likely the answer to your question is already on our website. But if it isn't, there's a number on there that you can call. And also, like I said, sometimes I suggest that people speak to their doctor, because some people have unique medical issues and it may cause them to have concern. They may have underlying medical problems that they don't feel comfortable talking with anyone other than their physician. And the physician will be in the best place to say, yes, you should get vaccinated, or no, you shouldn't. But it's an answerable question. And so sitting at home wondering, should you get vaccinated, doesn't solve anything. I would suggest make those phone calls, talk to somebody, find out whether or not vaccine is safe for you. And if it is, go get it.
Dr. Sherlita Amler, Westchester County Commissioner of Health, we thank you for coming back and updating us on COVID and vaccines and much more here on Westchester Talk Radio, what's happening in the Lower Hudson Valley. Let's talk again real soon, get another update from you.
I really hope that we can. And, I know that people, like I said, I understand there's concerns. I think we all understand it. But we just want to make sure that we can find a way to answer those concerns and hopefully get to a place where we can have a summer where we don't have to see people out wearing masks, where kids can enjoy the nice weather. And when we come back in the fall, school can go back in person and children can resume the life, because it's been so hard on our school children having to learn remotely, and parents having to worry about how they return to work when their children are home from school. So I'd love to get back to a place, I think everyone would, where the world is a little bit more like it used to be.
Bottom line, we can do this together, right?
We can, if we do it together. I mean, we've done harder things in this country together. We've overcome so much in the history of this country, and we can overcome this too. Together.
As I try to tell people, we've gotten this far. Don't let up your guard yet. Let's keep doing what we have to do, and then we'll get to that finish line.
And you are so right.
Not let up now. It's not time for the third or fourth string to get a few minutes in the game. We're still right in the middle of the game at this point, and we still have a ways to go. So, Dr. Sherlita Amler, we thank you here on Westchester Talk Radio, WestchesterTalkRadio.com, made possible by Entergy. We thank everyone at Entergy for all they've done for our communities throughout the years. Also by White Plains Hospital. Special thanks to our heroes at White Plains for all they've done throughout the COVID pandemic. And by Michael Labriola, landscape design and construction of our month, along with Robeson Oil, the house that Service built. I'm John Marino. Catch all of our Westchester, Rockland, Putnam, Dutchess, Orange, and Fairfield County Talk Radio programming on our YouTube channel, Sharc Creative YouTube.